Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha of Alameda from Roots Community Health Center, reporting for the week of November 15th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut the noise to give you information you can use to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. As you can see, looking at the United States 7-day case average, unfortunately, we never quite came all the way down off of that summertime surge, and now cases are heading up in the wrong direction here. Same thing worldwide. We are seeing an uptick in cases at a relatively high rate, and here in California, as well as in Alameda County, we are seeing a bit of a plateau, some potential signs of an uptick, which of course we don't want to see as we are getting ready to head into the colder months and the holidays where we anticipate more mixing. So we'll continue to keep an eye on that, but certainly now is the time to double down and do all that we can to keep from having too large of a winter time surge. And we know that COVID, like many other respiratory viruses, does have a cyclical nature related to the climate, and we see in other parts of the country as well as the world that those with colder weather are seeing upticks sooner than we are, and so we should all take that as a word of caution because oftentimes throughout this pandemic we have followed by a few weeks the UK and then by a couple of weeks the East Coast, so we should be keeping an eye on this. In some good news, and this is a new feature on the Alameda County COVID dashboard, and you can see here vaccines, and you can see first dose, second dose, booster dose, and so on. And so the most remarkable thing here, I think, is those green lines, which are showing first dose having a nice uptick here recently. And so that is some good news, because that is really who we are the most concerned about, is the remaining unvaccinated. Also good to see that people are availing themselves of those booster doses. And in the last couple of days, our governor said that anyone 18 and up could get boosters. And I think this is probably helpful in terms of eliminating any confusion, so that if you feel you would benefit from the booster, if anyone 18 and up feels that they would benefit from the booster, and it's been more than 6 months since their second dose of mRNA or 2 months since the J&J, then you are eligible to go ahead and get that, and there should not be any barriers to that. Of course, we know that the greatest benefit is going to be to those with waning immunity, so certainly people who are further out even than 6 months, people who are 65 and up, those that are 50 and up with underlying conditions, and anyone who has higher risk of exposure. But once again, really the focus has to be on those remaining unvaccinated, because those are the ones that are at the greatest risk of severe illness, and also that is how we can get ourselves closer to the threshold of people having some immunity that can slow down the spread of COVID-19. So in Alameda County overall, 86.8% of those who are eligible, well, those who are 12 and up, are fully vaccinated. Now we do have a new eligible category that's 5 to 11, and I think the dashboard will be updated accordingly at some point. Oakland is trailing right behind at 83.7% of those 12 and up being fully vaccinated. And in Alameda County, the dashboard is showing that already over 22,000 individuals 5 to 11 are already vaccinated. Nationwide, 1.55 million children under 12 have already received their first vaccine. And so that effort is really, it just came right out of the gate and is really fully underway, just having been out for 2 weeks now. And another new component of the Alameda County COVID-19 dashboard is this county metrics around the mask mandate. I'm not going to spend any much time on this, just to show you that we're only meeting one of the three criteria that we would need in order to relax those mask mandates. But heading into wintertime, speaking for myself, the last thing I'm thinking about is wanting to relax any mitigation measures right now, but this is something that you can reference on the dashboard. So today I'm going to attempt to clear up some areas of persistent confusion, questions, and comments that I'm still continuing to hear and see. And the first one is around the COVID vaccine, fertility, and pregnancy. And this one really has been very wildly misunderstood from the beginning, and I think there's some actually good reasons for that. So I'm going to try to take us through kind of how we got here with all of these theories and pieces of misinformation, and try to just do what I can to clear them up. So the first thing that really I think got pressed was really immediately when the vaccine was approved, because the CDC kind of came out and just said, well, we're not going to recommend it, but don't withhold it. And if you are pregnant and you want to get it, go ahead and get it. And this felt very waffly, I think, to most people who were paying attention. And that includes all the people that were trying to get pregnant, all the people that were pregnant. But I think it's worth explaining that there were no pregnant women specifically enrolled in the trial, because when you do a trial that specifically includes pregnant women, it's a lot harder and it takes a lot more steps, because ethically speaking, you are not just enrolling the mom in the trial, but you are also enrolling unborn baby in the trial. And there are actually quite a bit of regulations around this of how this can be done. And this is often not done because of how labor intensive and difficult it is to do. And so, in fact, this is a challenge, because sometimes, because it's just easier to exclude pregnant women, oftentimes pregnant women aren't eligible for things until later on, once a safety is established, or once somebody decides to go ahead and undertake that study. So that was the reason why pregnant women were not specifically included. When I say specifically included, that though all of those provisions were done, the risk benefit balance for both mom and baby were done. So that part, and then you'd have to randomize half of the pregnant women into the vaccine group and half into the control group. So all of those parts were not specifically done in the vaccine trial. And so that is why when it was approved, really you couldn't say affirmatively, absolutely, we're making this recommendation, until they got more information. And so that's exactly how it kind of unfolded. And it's important to note that during the trial, a few dozen women actually got pregnant. And there was no difference between the number that got pregnant in the vaccine group versus the control group. So there was no effect there of having received the vaccine on the ability to actually get pregnant. And there was also no adverse effect on mom or baby in either group. And so this is important just to say that despite the fact that they weren't specifically enrolled, we did end up having data on pregnant women, even just through the trial. And so then what happened is that thousands, tens of thousands, now hundreds of thousands of pregnant women have received the vaccine. And all of those associations that look over our moms and babies and make those recommendations were just pouring over that information as it was coming in, and making all of the assessments. And again, confirming the fact that there was no difference in terms of pregnancy outcomes for mom or baby between vaccinated and unvaccinated. And so then it went into a recommended status. So the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine, the American Society for Reproductive Medicine, they all came out and recommended that pregnant women get the vaccine. And then we started to get even more information, which I'll go over in a moment, that showed how much more at risk pregnant women actually were from doing poorly with COVID-19. And now the vaccine is considered urgently recommended by all of these societies, including the CDC as well. And so that was kind of the timeline around how the vaccine ended up being endorsed emphatically for pregnant women, but why it didn't start off that way. The next thing that happened was that there was this myth that was propagated by a couple of uh, scientists in the UK, and they put forward a petition to stop the vaccine, because what they said, and this got a lot of traction, is that they said that when you got the vaccine, that the antibodies that you then create would target a protein that is on the human placenta, and it's called syncytin 1, and that it would like attack the placenta, and then that would lead to infertility. And so there's been a lot of sort of looking into how did this even come about. And it's important to say that if you look at proteins, and if they're long enough, they're just series of amino acids. And if you look at these chains of proteins long enough, you can see that there's going to be little parts of them that are the same or similar. You're going to find strings of amino acids that are the same. And so it would be like saying we have the same phone number because there's a 30 in the middle of it. So we know that that just simply, it makes no sense because all proteins are some combinations of these same amino acids. And so it was just a huge stretch as it was, but researchers went even further in terms of investigating this. And one of the things that was kind of looked at was if your antibody response to the vaccine is going to attack the placenta, then so would your antibody response to SARS-CoV-2, so the actual infection, because the antibodies produced are the antibodies produced. And so basically, then we would expect that women who got COVID-19 would experience early pregnancy loss. And that simply wasn't the case. Women who are vaccinated have not experienced early pregnancy loss. And these are what you would expect if we were attacking the human placenta. And so, and actually, there was a case controlled study that looked at 225 pregnant patients, and the link is in the notes for this video. And it was published in the journal Obstetrics last fall. And they concluded that even severe COVID-19 illness during the first trimester did not predispose any of the patients to early pregnancy loss. So actually a rigorous examination here that kind of confirms this. And so even though this claim sounded credible at first, they made it sound really good and it got a lot of traction, there really was no credence to it. And in fact, there were some scientists that took a look at comparing different proteins and said, well, if we go by that, then these antibodies should be attacking our collagen and our keratin and things that just make up our entire skin and body. And so this just isn't the way that we go about trying to determine if there's going to be an effect. And it just has not panned out. And unfortunately, it caused almost, quite a bit of, I think, concern that really spread very wildly, even though it had no credence at all. And the third thing that happened was that after the rollout of the vaccine, there were a number of women who reported menstrual irregularities after they got the vaccine. And so there was a couple of issues with this. First was that this wasn't listed as one of the side effects. And so naturally, people were concerned because, just imagine if they never said that you could get chills, or a sore arm or something like that from the vaccine. And then all of a sudden, a number of people started reporting it. Of course, we would all get concerned. And so that is natural. But unfortunately, instead of just looking and saying, okay, we need to examine this, it created almost this scandal because, first of all, I think people were making conclusions from, menstrual regularity, which I'll tell you why that's not the appropriate thing to do right first. But also, I think it wasn't taken as seriously as we would all like to have seen it taken. And this is not uncommon, unfortunately, in things with women's health where it's kind of brushed to the side and, well, we don't know the data yet, and that may all be true, but this is something that needs to be taken seriously, and luckily it is now being taken seriously, and there's some study going into really kind of looking into this and being able to quantify that, because we know that that is something that is important, and so we'll be able to understand it better. But really, I think the fact is that the entire female reproductive system is a system that responds. It responds to immune challenges. So it responds to infections. It even responds to stress. And it responds to vaccines, which stimulate and challenge the immune system. And so it is not something that is of any alarm, that there would be some short-term irregularities, and they are just that. They are typically short-term, and some women just tend to be sensitive in that if they're stressed and everything gets thrown off, it could be thrown off for a couple of months. And that would not be unheard of. And again, there will be more information coming out about this, but there's absolutely no correlation to anything having to do with fertility or pregnancy outcomes. And in fact, the sad and really tragic fact is that pregnant women who catch COVID 19 are at a risk for a number of things. They are at risk for preeclampsia, which is having dangerously high blood pressures during pregnancy. They are at risk for preterm birth, low birth weight babies, stillborn babies, and especially if their course of COVID is a more severe course, which they are more likely to get. So, moms who catch COVID 19 while pregnant are 3 times more likely to go to the ICU. They're 2 to 3 times more likely to be intubated and need mechanical ventilation or some type of breathing support. And they're 1.5 times more likely to die than their age matched counterparts that are non pregnant. Babies born to moms who caught COVID are more likely to be admitted into the neonatal ICU as well. So these are very dire consequences of catching COVID 19. And we have absolutely no evidence that the vaccine is causing any problems with pregnancy or fertility in women. And so we really do want to urge, because I do hear and I do understand when you're pregnant, you're so careful of everything that you put into your body, and it's completely understandable. But I am still continuing to hear people saying that they want to wait until they deliver the baby and then get the COVID 19 vaccine. And we are really urging to not do that, because then it might be too late, and it could be too late and cause damage to both you and baby. So it's very important to heed the recommendations of all of these societies of physicians and scientists that really only goal is to ensure the health and safety of moms and babies. When it comes to men, also no change in fertility. There was even a study that looked specifically at sperm count, and I've included that in the notes as well, and that looked at sperm count from the vaccine, and there was absolutely no change in sperm count from the vaccine. Whereas COVID, on the other hand, has some pretty profound effects on male health. And I went over this in great detail with Dr. Dawood Langford. He is a urologist, and he presented on erectile dysfunction with COVID 19 in the June 8th, 2021 briefing. So if you're interested in all of the details on that, please check that out. Now, the second area of confusion I just wanted to briefly touch on is that there's still hospitalization and death among people who are vaccinated. And one of the challenges we're having here is that the monitoring and the surveillance of all breakthroughs, and we're talking about hospitalizations and deaths among vaccinated, as well as cases among vaccinated. It's probably it's being tracked at a number of different levels, and it can make it a little bit difficult to really wrap our arms around it, because that's why sometimes you'll see studies coming from this hospital or that hospital or this county, and it becomes difficult because as more people become vaccinated, the all of the denominators basically keep changing, and so it becomes very difficult. We feel like we're always just comparing apples and oranges. So this is a natural challenge that we're having, and we really do wish that at the level of the CDC there would be some strengthening in tracking uh, cases by vaccination status, and hopefully we'll be getting there soon. But I just wanted to share briefly probably one of the larger assessments that I've seen, and it actually comes from the Texas State Department of Health Services. And so this is an entire large state that was taking a look at all cases and deaths by vaccination status. I'm not going to spend a lot of time on it. I've included the link in the notes. But they looked at January 15th, 2021, which was the point when the first Texans were fully vaccinated, through October 1st of 2021. So this is a pretty nice swath of people. And these were not small numbers of people they were looking at. They were looking at over 1.5 million cases and at over 28,000 deaths. And I've put the link to the article in the post. But really, the key findings were that unvaccinated people were 13 times more likely to catch COVID 19 and 20 times more likely to die from COVID 19 than fully vaccinated people. And so I think this is something that we need to continue to watch so that we can really quantify it. We may not be able to quantify it perfectly, and it may be different as we look at different age groups and different geographies and different other mitigation strategies that people are doing. So we shouldn't expect this number to be perfect as we go forward. But we do know that the majority of people who are dying from COVID 19 who were vaccinated are in the group that is eligible for the additional dose or the booster. And if they are in those vulnerable populations, that is the best remedy for them, is to actually receive the booster. But for those that are unvaccinated, they're still remaining vulnerable, and they still have that unpredictable risk of going to the hospital or of dying from COVID 19. And this study was showing that it was at least 20 times more likely to happen if you were unvaccinated than if you are vaccinated. So there will be more to come on that. The other one I've been hearing a lot lately is that if the vaccine really has effects that are not long term, then why is it that the clinical trials are continuing to evaluate people for years out? And so I wanted to unpack that just a little bit. So we know that in the history of vaccines, throughout the time that we've had vaccines, that when there are adverse reactions, they tend to happen within the first 4 to 6 weeks, really no more than 8 weeks out. So vaccines don't stick around in your body. So if you're going to have an adverse reaction, it's going to be pretty shortly after you get the vaccine, and that's just the nature of vaccines. So these are not medications where you find out after you've been taking it for a year that there's an issue and it has to be recalled. Those things do happen, but that's because that's something you continue taking every day, whereas the vaccine, it's gone from your body, so nothing new is going to happen after that time period. So why are they still studying it, and what is this about? So I think it's two things. One is that if you go to clinicaltrials.gov and you look at the vaccine manufacturer's study, you will see that they are projected to complete their study in 2023. So they are continuing to take a look at the vaccine to 2023. But I think it's really important to notice that what they're looking at up to 2023 is actually about the effectiveness of the vaccine. So this is not continued safety monitoring. That part has already been completed. And now it has gone to the monitoring system. So we continue to monitor for safety, but that's really in the post-marketing phase, or basically now it's out on the market, and we've all seen how if there is a safety signal, it gets caught, and they basically end up letting us know. And it consistently has been within that first 6 weeks or so after vaccine administration. So nothing is new there. But they will want to continue to see how effective the vaccine is. And so, just like any intervention that we do, we're going to want to continue to see how effective it is over time. And so that is why the studies are continuing out to 2023. So this has nothing to do with, oh, in 3 years we're going to find out the vaccine did something bad. That's just not how it works or how it happens. The other thing that I mentioned when I did the review of the 5 to 11-year-old vaccines is that the all the monitoring bodies are saying that if there is an adverse effect, like let's say myocarditis, they will be studying those folks for at least 5 years to see how they do from the adverse effect. So once again, it is not because we are expecting to 3 years or 5 years later find out that this vaccine somehow magically did something to us, because it's just not plausible. We say not biologically plausible. It's not around in the body any longer. And so we expect to see any safety signals we're going to see within 6 weeks. But of course, we have to keep on monitoring it over time to see how effective it will be, and also to continue to monitor anything that did happen during that period of time. And the last point that I want to try to clarify today that I'm still hearing is this notion that you can't sue the pharmaceutical companies, and somehow that's an indication of something nefarious going on because they can't be held liable. And so I just wanted to give a little bit of history on this. This is actually not a new thing at all. This has been in place actually since the 80s. And part of this was because in the 70s and 80s, there were actually a number of lawsuits regarding vaccines. And there were the pharmaceutical companies basically threatening to stop making vaccines. And that is a huge threat to the public health and safety of the American people. And that has to do everything with, our capitalistic society and being a litigious society. And that the decisions are essentially in the free market going to be made around money. And so the pharmaceutical companies, they really don't make their money off of vaccines. They make their money off of, HIV treatments and, all kinds of other actual things besides vaccines. Vaccines is not where the money's at. So they were not going to have any motivation to even make vaccines. And so in 1986, there was an amendment to the Public Health Services Act to establish within the Department of Health and Human Services a national vaccine program. And that, for the purpose of that program, is to direct vaccine research and development, and ensure that vaccines are being produced and procured, and that we have safe and effective vaccines for the entire population, and also to direct the distribution of vaccines so that we make sure that everyone has access to vaccines. And certainly, there is no child in the United States that does not have access to safe and effective childhood vaccines, and that is in part due to this amendment. And part of this signed into federal law what is called the National Childhood Vaccine Injury Act of 1986. And the purpose of this act was actually to give appropriate financial compensation for injury from vaccines. So you can imagine a person believing that they're injured by a vaccine trying to take on big pharma in a lawsuit that is costly, it is time consuming, and once again the drug companies weren't even having it. And so this fund was essentially created in order to essentially take away some of that risk for the pharmaceutical companies and encourage them to keep making vaccines, but also to put forward a way for people to be able to be compensated in the event that they were injured by the vaccine. So it's really a compensation fund, and it is actually paid for by a tax on the vaccine company. So they're not getting away with, they're still paying into it. But it is based on this premise that the vaccine is guilty until proven innocent. Yes, guilty until proven innocent. So basically, it believes the claims and then it gathers the evidence, and it really isn't attempting to necessarily find fault. And at least half of the claims are ultimately paid out. And, this is cheaper and easier than filing a lawsuit. It's basically filing a claim, and there is this fund that is basically established for that purpose through money that comes from the pharmaceutical companies. Let's face it, people in this country do sue a lot, and it really drives up the cost of healthcare tremendously. And for vaccinations, that was not something that we could be risking. So if you've gotten any vaccine yourself or your children have gotten vaccines, you've received these sheets, these vaccine information statements. So here's the one for the tetanus vaccine, and you can see here that it has the information, and every single one of these vaccine information sheets has this information of where you report if you believe that you had a vaccine injury. And there's an actual process here. Since this fund was established, it has paid out $3.9 billion. That's with a B, $3.9 billion in settlements. About 17,000 petitions have been evaluated, and about 6,000 have won compensation for the vaccine injuries in 2020. Actually, as of September 1st, 2020, The program had awarded over $175 million to 652 claimants. So that is a few decades old system. And so with the COVID-19 vaccine, it is slightly different. It's not hugely different. It's called the Countermeasures Injury Compensation Program. And I put a link to a table comparing the two injury compensation programs in case you're interested. It's a pretty simple little table. And this is because we are in a pandemic. And so a countermeasure is any kind of vaccine or device or medicine or any other item that is recommended in order to diagnose or prevent or treat during a pandemic or a security threat. And so, on that rare chance that you suffer a serious injury or death of a loved one from the administration of any countermeasure, then you may qualify for these benefits. You file the Countermeasures Injury Compensation Program claim for benefits if you believe that this has caused serious injury or death. Has to be submitted within 1 year from the administration of the countermeasure, which in this case, we're talking about the vaccine here. And you can expect to have to submit necessary medical records and like the COVID vaccine card. And they process through the documentation, and they're doing so really as we speak. They've already paid out $6 million. And again, we know that no vaccine is absolutely perfect. We know that adverse impacts are exceedingly rare, but it is not that there is zero liability. There is a program in place. This is not new, and it's not a whole lot different from the program that covers all the other vaccines that we give to our children, dating back over 30 years now. So remember, we are at a point now where we are primarily concerned about heading into a winter surge. And even though we do know that we will see somewhat of a decoupling, in other words, cases and deaths will be not as closely associated as they were last year at this time before people were vaccinated. So as cases went up, we would see deaths follow by about a month or 6 weeks. And that will still be the case, but only for the unvaccinated, or primarily for the unvaccinated. And so, while we do expect that deaths will be much lower this year, we don't know how high cases will get. So, we really can't estimate what the impact of this might be. It's hard to see out that far, as we know with COVID from what we've learned in the past. But primarily, we can expect to see a very similar curve for the unvaccinated, where as cases go up, hospitalizations follow by a couple of weeks, and then death follows by another month or so. And unfortunately, the math on that has not changed a whole lot. And although we do have treatments on the horizon right now, we are still looking at the pandemic actions we need to take now are vaccinate the unvaccinated, boost those that are at risk. I think we should all be embracing our outdoor activities and do what we can to make our indoors safer, whether that is opening windows, improving our ventilation, perhaps utilizing some CO2 monitors to get an assessment of our ventilation and of interventions that will improve the ventilation. We want to test strategically, so that includes knowing when to do which test. If you are planning a gathering that mixes households, you may want to consider everyone doing a rapid test right before they walk into the gathering. This will mitigate considerably, and if someone tests positive in that situation, believe them, and they would not need to be included in that event. And then we want to be able to work quickly once we have positives to isolate and contact trace, call everybody, let them know they were potentially exposed, and particularly do these things so that we can treat timely. So if you are in a high risk category, especially, you need to know as soon as possible if you are positive so that you can get treated and perhaps can save your life or keep you from getting very sick and going to the hospital. And last but never least, wear high quality fitted masks, particularly if you are unvaccinated and going around others. It is still an important mitigation strategy that I think we would be wise to continue in this next phase. And to optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing. Please join us next Tuesday at 10 a.m. See you then.